Welcome to the podcast. My name is Dr. Noor Gajraj. Let's talk about metastatic prostate cancer, what you need to know. About 1 in 8 men will be diagnosed with prostate cancer during their lifetime. Most cases, about 6 in 10, are diagnosed in men aged 65 years or older, and it's rare in men under the age of 40. The average age at diagnosis is around 67 years. Incidence rates declined sharply from 2007 to 2014, likely due to changes in screening recommendations, but have since increased by about 3% per year since 2014. Historically, about 4 to 5% of prostate cancer diagnoses are metastatic at the time of initial diagnosis in the United States. This percentage has fluctuated over time, influenced by prostate-specific antigen (PSA) screening rates. When PSA screening was more widespread, more localized cancers were detected, and the percentage of metastatic diagnoses was lower. Let's look at some physiology. The hypothalamus in the brain releases gonadotrophin-releasing hormone, GnRH. This stimulates the pituitary gland to release two other hormones, luteinizing hormone, LH, and adrenocorticotropic hormone, ACTH. LH then signals the testes to produce testosterone, while ACTH stimulates the adrenal glands, which also produce a small amount of testosterone. Prostate cancer staging uses the TNM system. T for tumor size and extent, N for lymph node involvement, and M for distance metastasis. T stages range from T1, confined to the prostate, to T4, invading adjacent structures. N indicates if nearby lymph nodes are affected, N0 or N1, and M shows if the cancer has spread to distant sites, M0 or M1. These categories, combined with PSA levels and Gleason score, determine an overall stage 1 to 4 to guide treatment and prognosis. All metastatic prostate cancers are initially considered castration-sensitive prostate cancer, or CSPC, at the time of diagnosis. This means that the cancer is still responsive to treatments that lower testosterone levels, androgen deprivation therapy, or ADT. For example, if a man is diagnosed with metastatic prostate cancer, his first-line systemic treatment will almost always involve ADT, either alone or in combination with other agents. Metastatic castration-resistant prostate cancer, mCRPC, is a state that develops over time. It occurs when the metastatic prostate cancer progresses despite the patient being on ADT and having castrate levels of testosterone. This resistance doesn't mean the cancer is completely independent of the androgen receptor, but rather that it has developed mechanisms to grow and spread even in a low testosterone environment. To reduce testosterone, there are a few options. Surgical castration, also known as bilateral orchidectomy, which is the removal of the testes, or more commonly, chemical therapy, which uses medications to block or reduce hormone production. Treatment for castration-sensitive prostate cancer. For metastatic castration-sensitive prostate cancer, or mCSPC, treatment goals are to reduce testosterone and control the disease. Here are some key strategies. GnRH agonists or antagonists. The chemical castration we just discussed, often combined with newer anti-androgen therapies like abiraterone, palotamide, or enzalutamide. This is often the approach for very low volume disease or if the patient isn't suitable for chemotherapy. Metastatic castration-resistant prostate cancer, mCRPC, is when prostate cancer progresses despite low testosterone levels. Even at this advanced stage, various effective treatment options are available. These include chemotherapy agents like docetaxel and cabazitaxel, immunotherapies such as sipuleucel T. Other treatments encompass abiraterone, enzalutamide, both usable before or after docetaxel. Managing bone metastases. A very common complication in metastatic prostate cancer is the development of bone metastases. In fact, about 90% of patients with metastatic prostate cancer will develop bone metastases. These can cause pain and increase the risk of fractures. To manage bone health and pain, treatments include zoledronic acid, strontium, samarium 153, and radium. The 5-year relative survival rate for metastatic prostate cancer is around 34 to 37%. This means that about 34 to 37% of men with metastatic prostate cancer are still alive 5 years after diagnosis. Factors like the extent of metastases, overall health, and response to treatment can all influence a person's individual survival outlook. I hope you have found this talk helpful. Please consider buying my new book, 100 Pathways to Longevity, and please subscribe to the channel.